Dear colleagues, my name is Polina Pilius. I'm a radiologist and I would like to present you my first webinar for Health Tech Without Borders. The topic for today is challenges of chest X-ray performing for aim to provide teleradiological support. This presentation should be useful above all for radiographers who are working or are going to work with teleradiology. Let's start with some basics. Teleradiology is a subspecialty of radiology that involves the electronic transmission of radiological images and data over the distance for the purpose of interpretation and consultation. Teleradiology was first introduced in the 1960s, but it was not widely adopted until 1990s. The use of teleradiology has increased dramatically in recent years, particularly with the advent of new technologies and the growth of telemedicine. The COVID-19 pandemic has also accelerated the adoption of teleradiology as healthcare systems have had to rapidly adapt to remote care models. Teleradiology can help to resolve a number of problems related to the delivery of medical imaging services, including limited access to radiologists. In many areas, there is a shortage of radiologists and other medical specialists, which can limit access to diagnostic imaging services. Teleradiology can help bridge the gap by providing remote access to radiological expertise. Delayed diagnosis and treatment, especially in areas where there is a shortage of radiologists or where images need to be transferred to a central facility for interpretation. Inconsistent interpretation, when medical imaging studies are interpreted by different radiologists, which can lead to diagnostic errors and delayed treatment. Teleradiology can help address this problem by providing access to a larger pool of radiologists with different areas of expertise. Insufficient use of resources. In some areas where medical imaging equipment may be underutilized due to a lack of radiologists or other medical professionals, teleradiology can help optimize the use of these resources by allowing medical images to be interpreted remotely. During emergency situations such as natural disasters or public health crises, teleradiology can help provide rapid access to diagnostic imaging services and remote radiological expertise in this situation. Overall, while teleradiology offers many potential benefits, it is important for healthcare providers and policymakers to continue to monitor and address the issues and challenges associated with its use. Some of the most important issues surrounding teleradiology include quality control, patient confidentiality, and the potential for the diagnostic errors. Take a look at the result of a comparison of the number of mistakes which were made by radiologists who worked remotely in different areas and modalities. The lower brown portion in the gap means result that concurs with interpretation of experts. The middle light brown portion in the gap show discrepancy in interpretation that not ordinarily expected to be made. The upper white portion means discrepancy in interpretation that unexpected to be made. Of 12 peer reviews, 8.9% cases had unacceptable diagnosis. In radiology sections, the unacceptable diagnosis was highest in the musculoskeletal section, followed by abdominal and neuro section. Radiographers play a critical role in teleradiology by acquiring and transmitting high-quality medical images and providing all necessary information that can be interpreted remotely by radiologists. However, in order to optimize the work of radiographer and avoid errors in the teleradiology process, it is important to ensure that they receive appropriate training and support. One study published in the Journal of Medical Radiation Sciences in 2080s found that providing radiographer with training resulting in improving image quality and reduced errors and in image transmission and interpretation. Another study published in the Journal of Digital Imaging in 2090s examined the impact of using standardized protocols and checklists for image acquisition and transmission in teleradiology. The authors found that its use significantly improved the accuracy and completeness of images, as well as reduced the number of repeat examinations and unnecessary imaging. These are common mistakes in performing X-ray exams. Incorrect positioning of the patient, it occurs the most often, according to the research. Movement during the X-ray exposure, failure to collimate the X-ray beam to the area of interest, incorrect use of X-ray equipment, or failure to follow appropriate imaging protocols, failure to use appropriate exposure settings, such as incorrect KVP or milliamps seconds settings, failure to identify and mark appropriate imaging landmarks, such as the carina and diaphragm. Two-dimensional chest X-rays studies are not easy to access because of so-called blind areas, which can hide sometimes pathologists, even for experienced radiologists. That's why the quality of the chest radiograph is an essential component in the accurate interpretation. The anterior chest, including lung abscesses and costophrenic angles, should be included in the field of view. Patient rotation, the depth of inspiration, and the degree of photon penetration can influence the conspicuity of underlying pathology. Artifacts from overlying objects, such as jewelry or clothing fasteners, or from intervening devices, including pacemakers or automatic implantable cardioverter defibrillators and chemotherapy port catheters, are potential distractors and can also obscure small lesions. Now I would like to share some practical examples for better understanding of basic approaches to avoid the decrease of image quality. Posterior anterior chest radiograph in a 48 years old woman shows no abnormality. On the lateral radiograph, a nodule is seen anteriorly at the level of the hilum. Axial CT image in lung window demonstrate a lung middle lobe nodule directly interlined with right hilar structures. Subsequent CT-guided biopsy demonstrated lung metastasis from an axillary adenoid cystic carcinoma. So lateral radiographs sometimes matter a lot, and it's much better to perform than skip. Superimposing structures. If the arms and shoulders are not correctly positioned, structures may superimpose. Left scapula. Left image shows an example of bed patient position with scapulae overlapping the lung fields, yield shadow, and decreasing the image sensibility in this area. The right one presents a chest X-ray with correct the projection of the scapula out of the pulmonary fields, green lines. Degree of rotation. On the left, we can see an adequate centered patient with the spinous processes forming a vertical line, green line, equidistant from the inner edge of the clavicles. On the right, the patient is rotated. The spinous processes are closer to the inner edge of the right clavicle. Inspiration. The left chest X-ray is an example of insufficient inspiration effort, where only about 5 anterior rib arches and 8 posterior superimpose the lung fields. The right chest X-ray has a satisfactory inspiration degree, showing about 6 anterior rib arches and 10 posterior. Note the orientation of the anterior rib arches more oblique, and of the posterior ones predominantly horizontal. X-ray penetration. A right chest X-ray is an example of an adequate degree of X-ray penetration, being possible to delineate the vertebral body's contours through the cardiac silhouette. The left radiography has insufficient X-ray penetration, appearing whiter than usual, and it's not possible to guess the vertebral bodies through the cardiac silhouette, with less definition of the structures, including the pulmonary parenchyma, decreasing diagnostic accuracy. It is very important for radiographers to provide to the radiologist all the information regarding the presence of any surgeries and reconstructions in the region. Evidence of left mastectomy and breast implants reconstruction are seen as ill-defined opacities superimposed over the left hemithorax, which can be misdiagnosed with pathology. But on CT, we can see the evidence of left mastectomy and breast implant reconstruction are seen at left side. The role of follow-up images is also essential, and providing it to the remote radiologist is required. 63 years old woman with 4 days history of productive cough and fever and pleuritic chest pain. Initial posterior and lateral chest radiographs were interpreted as lingual pneumonia and small left pleural effusion. Follow-up chest radiography, posterior and lateral, obtained 6 weeks later to ensure clearing of pneumonia with improved clinical symptoms, and it shows incomplete clearing of lingular opacity and enlargement of left hilum. Chest CT was recommended, and axial contrast enhanced CT images of chest obtained 2 days later in lung and mediastinal windows show atelectasis in lingula and central non-small cell lung cancer obstructing lingular bronchi. In order to reduce the risk of improper performance of such studies as chest X-rays, the use of international guidelines is recommended. For example, last year, the following guidelines, jointly executed by American College of Radiology, the Society of Pediatric Radiology, and the Society of Thoracic Radiology, practice parameter for the performance of chest radiography were updated. Here are some practical points that you can learn. We are living in artificial intelligence era, and it spreads very fast in our routine life. So during the last year, the Oxipit company demonstrated their first autonomous CE-approved service that differentiate normal cases from cases with pathology on chest X-ray. It suggests that radiologists receive only studies that AI define as abnormal. And of course, it requires perfect image quality and means very high responsibility of radiographer. But at the same time, for teleradiology, it has some advantages too, because it helps to receive the first report earlier and helps to differentiate emergency cases for faster response. Some AI tools are already being used to assess the correctness of performing studies. They help to double-check the image quality, identify systematic errors, and further organize the training of radiographers. In one of the recent studies, it is shown that the use of real-time AI can improve the quality of images with respect to collimation, patient rotation, and inspiration is achieved by 30%. A detailed analysis is presented that shows that the average unnecessary exposed area is reduced by 34%. The use of teleradiology has some limitations due to impossibility of real-time detection of some urgent cases. So if radiographers is familiar with common features, that means the emergency, it is a great advantage. Let's look at the first case. Chest X-ray posterior anterior view shows gas under the diaphragm. and regular sign, gas on both sides of bowel wall. It is a sign of pneumoperitoneum and requires an urgent surgery. Surgical follow-up shows perforated duodenal ulcer. The next case, the nasogastral tube deviates to the right at the level of the carina, and the tip is seen projected over the right hemidiaphragm, likely in the right lower lobe of the lung. It is malpositioned nasogastric tube in the right main bronchus, and it must be removed immediately. The next one, there is a displacement of aortic arch calcification away from the aortic sigmoid. This indicates lifting of the intimal calcification. The heart contour is enlarged with the spleen of the carina to indicate left atrial enlargement. On control enhanced CT on coronal image, the displaced calcium is clearly visible. Contrast is seen filling both the true and false lumens of a thoracic aorta dissection, and this is thoracic aorta dissection stand for type A, with mortality reaches up to 90% in untreated patients. In conclusion, I would like to share an example of chest list for radiographers, which is better to have in the workplace to check yourself. This can be useful to make sure that you haven't forgotten any important information. You can add to this list whatever you deem necessary in your department. Teleradiology has great potential and benefits for development of technological care for patients around the world. However, in order to prevent the possible undesirable effects from such technologies, it is necessary to analyze the process from all sides. The work of radiologists and radiographers often implies changeable working conditions and adaptation to them associated with the rapid development of technologies and industry. We have constant education and training in our hands to improve the quality of work and help more patients. Thank you very much for your attention.